I wanted to actually continue discussing the issue of cost because we talked about universal health coverage and all, and I wanted to go to Dr. Roma, but Madam talked about last mile. So therefore, I was in a bit of dilemma as to whether I go to last mile, because last mile is what I work for. So I'll come to Anil after I talk to you. So can you elaborate your sort of perspectives in terms of you आप एक बहुत ही जाने माने संस्था को represent करते हैं, the first I think company that started insulin in the world. आपका क्या कहना है इस बारे में कि insulin is still not affordable in our country or in LMICs, and what can companies like you do for the benefit of the
Type
suffering
1.
kids? Thanks.
Access to life-saving insulin, especially for type 1, still is a very, the access is very, very less across India. If we,
Yes.
when we do our surveys,
Yes.
there are around 60 million diabetic patients, and as per World Health Organization, the access should be at least 80%, and we are far, far away from there. As an organization, we try to help type 1 diabetes by creating diabetes. I have a team which works with top doctors in institutions, in ESI setups where these diabetes patients are trained by the diabetes educators on how to use insulin, what are the type of lifestyle modifications they can do. We try to create that awareness about type 1. We use a very digital tool. It is called as Conversation Map, where these type 1 patients are called along with their families, and they are trained on managing type 1 diabetes in a better way. Beyond that, like what the Medtronics team was saying, there are cities, there are some states like Kerala, Chattisgarh, I would like to name few, who are really working on affordability of this life-saving drug for insulin. They have made it free in these 2 cities, and they are ensuring everything. They are taking drugs from us, but they are giving free drug to the patients. One city I would like to name, not because Dr. Devashish Basu is here, that is Kolkata. The medical colleges in Kolkata, you will see insulin is provided free of cost to all the patients who go to these medical colleges, and the kind of treatment they get, and as an organization, we support these institutions by providing our diabetes educators and helping these patients live a better life.
Yeah, thank you very much. I think this is very, very important. I was part of the Uday project, some time back.
I know.
So I know some of these, mapping exercises.
Correct.
And I hope you have
Sonipat
and
Vizag.
Yeah, sure. So thank you very much. That gives me a segue to actually talk about the last mile. So I think Chennai में study हुई थी. I don't know whether it's Dr. Mohan's or Ramachandran's. I have a list of complications that were published in this study. 20 साल के नीचे के बच्चों में जो डायबिटीज से पीड़ित हैं, उनमें चेन्नई में ये स्टडी हुई थी, और इस स्टडी के मुताबिक 13.4% को रेटिनोपैथी, 7.1% को नेफ्रोपैथी मतलब किडनी की बीमारी, 3% को सेंसरी न्यूरोपैथी, और 0.5 इस्केमिक हार्ट डिजीज़ और पेरिफेरल वास्कुलर डिजीज़ के प्रॉब्लम्स पाए गए हैं इस स्टडी में. It's an interesting fact also that compared to Western countries, peripheral vascular disease seems to be less prevalent in our kids. I don't know what reasons you may